Scoliosis is a deformity of the spine, or as I like to say, a special shape of the spine that is either in the front plane, where as you look at yourself or someone else, that the spine seems a little shifted to one way or the other, right or left, or from a side view where the spine can be twisted where somebody is bent too far forward or backwards. The range can be anything from completely asymptomatic to completely debilitating, depending on the magnitude and where the bend or the special shape occurs. One of the misnomers with scoliosis is that it hurts, and in fact most of the time it doesn't. That was the basis for a lot of the screening programs in junior high and grade school, where the public health nurse or the school nurse would look for the deformity because people didn't know they had it. In children, it can be a change that happened during the growth process, the birth process in the womb. They may have a area of the spine that prematurely closes. That would be the growth plate that we all have. But in the spine, if one of those closes or it has an extra piece, it can cause an imbalance in the spine, which can create this misshape or the special shape of the spine. In older children or adolescents, or what we would call idiopathic scoliosis, they haven't completely determined what is the source of that deformity. It's almost certainly a genetic predisposition. Obviously, the children that had scoliosis as a youth grow up and lead healthy, productive lives, and then later in life they develop all they're still prone to the back problems that you and I would get otherwise. Some people develop very severe arthritis in the spine, which can lead to an imbalance or a sagging of the spine in one way or the other, which again creates that special shape that's out of alignment, which can predispose to some problems as an adult. So as an adult, again, most people don't have a lot of trouble, but when they get the arthritis that we all get as we all age superimposed on their scoliosis, such as in the baby boomer crowds, that creates a special combination which can be quite problematic. Softening of the bones, osteoporosis, whether it's from a chemical reason, they're being treated by a medication in men, such as for prostate cancer, or in women, either peri or postmenopausal, can predispose to the softening of the bones, and in the case of a fracture, a shifting again out of that normal alignment into that special shape, which may cause them an imbalance. But the arthritis also, that means the wearing out of the disc joint or the facet joints, can let the spine sag basically into a bad position. It's been an enormous increase in the uptake in both the appreciation of the disease from a patient perspective, as well as the technological evolution on how to manage it. The balance is balancing the patient's suffering versus intervening too soon. We don't want to put a very large, expensive, painful, potentially procedure in front of some of these more basic foundation treatments, but we don't want people to suffer too. So we do have the technology. In principle, the treatments are the same as a child. You're treating the deformity. But because of the age and healing and the differences in bone quality, it really is a different world. I think a lot of it is just our appreciation and desire for a higher quality of life at the later stages of life, not the end of life, but as we, they say 60 is the new 50 or 50 is the new 40, and I think we want to be more active. We're educated about the possibilities, and we demand it. We demand that quality of life, and women are demanding to stay active, to have good bone health, and to address any perceived deficiencies that the special shape of the spine as it becomes scoliotic has placed upon them. You can ask the question, is my bone health what it should be or what I expect it to be? And that involves seeing your provider, getting screened, and then taking action to prevent that softening of the bone, because once the bones start to break with the osteoporosis, we can't undo that fracture. It really changes their whole sense of self-image. Functionally, there's some very measurable, demonstrable benefits. Ability to walk longer, less pain medication use. But the thing that's a little more hard to quantify is that sense of well-being, that beaming of somebody who looks at themselves in the mirror and sees that shape that they used to be in, not a sagging, deformed, different shape that they've become.